Small intestine 11 is found at the junction of the upper third and lower 2/3 of a line joining the midpoint of the inferior border of the spine of the scapula and the inferior angle of the scapula. It roughly makes an equilateral triangle with small intestine 9 and small intestine 10, but this is not always accurate. To find small intestine 11 accurately, you first need to identify all of these landmarks. To find the medial border of the spine of the scapula, place your hand on the back where you think the medial border might be. If it's not palpable, a slight amount of pressure on the shoulder will help to bring the medial aspect of the scapula into relief. To find the lateral extremity of the spine of the scapula, palpate along the spine until you find a bump at its end. Be careful not to go completely to the end of the shoulder. This is the end of the acromion process. It's not the end of the spine of the scapula. To find the inferior angle of the scapula, palpate down the medial border until you can find the scapula changing direction at its bottom. Once again, if this is not palpable, it may help for the person to put their arm behind their back. This will bring the angle, the inferior angle of the scapula, into relief. It's important to remember that once you've located it, you need to keep your finger on it as the person moves their hand back.
Kidney 15 is on the lower abdomen, fourth and superior to the symphysis pubis, at the level with Ren 7 half a cent lateral to the midline. Spleen 15 is fourth cent lateral to the centre of the umbilicus. So Sanjiao 3 is on the dorsum of the hand, proximal to the 4th and 5th metacarpal phalangeal joint. Locate this with the hand in a loose fist. Run your finger over the joint head in between the 4th and 5th bones. Just wiggle the fingers to make sure that you're not on the bone, and popping your point in. Sanjiao 4, which is on the dorsum of the wrist, in between two tendons, extensor digitorum communis and extensor digiti minimi, and popping my point in.
Sanjiao 6 is located 3 cm proximal to Sanjiao 4. It's in between the radius and the ulna, and it's on the radial side of the tendon of extensor digitorum communis. Wiggling the fingers will bring this tendon into relief.
Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the two tendons palmaris longus and flexor carpi radialis. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between two tendons, palmaris longus and flexor carpi radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpi radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again.
Pericardium 8 is found on the palmar aspect of the hand in this nice dip which is proximal to the junction of the heads of the second and third metacarpals. The point is just a little closer to the head of the third metacarpal.
Heart 1 is in the centre of the axilla. You need to locate this point by abducting the arm. This brings the pectoralis major muscle into relief. The point in the centre of the axilla is posterior to this pectoralis major muscle, but not on the torso. It's where the arm and the body join. Heart 3 is at the medial aspect of the elbow, midway between the medial epicondyle of the humerus and pericardium 3. So coming midway between those 2 points at the medial aspect of the transvercubital crease. Heart 6 is on the flexor aspect of the forearm. It's half a sun proximal to heart 7 on the radial side of this flexor carpal ulnaris. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. To find lung 10, find the midpoint of the shaft of the first metacarpal and go in between that point and the muscle of the thenar eminence.
Lung 11, it's at the radial nail point of the thumb. So in order to find that point, I'm going to look at where the proximal and radial borders of the nail meet. I'm going to look at the nail bed, feel for where the flare of the bone is, and put my point in.
The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle, it's in a tender depression. Stomach 37 is located 10 cm superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the breadth of your patient's finger, not your own. Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus.
Kidney 1 is on the sole of the foot, between the second and third metatarsals, approximately 1/3 of the distance between the base of the second toe and the heel. It falls into a depression when the foot is plantar flexed.
Kidney 3 is located in the medial aspect of the ankle. It's on a level with the prominence of the medial malleolus in between the posterior border of the malleolus and the anterior border of the Achilles tendon, the tendocalcaneus. Palpate for the deepest dip and mark your kidney 3 there. Kidney 8 is located half a cm anterior to kidney 7. First locate your kidney 3, move up 2 cm to find kidney 7, then move half a cm anterior to find your kidney 8. Kidney 8 is off of the medial border of the tibia.